So the Whipple procedure is an operation designed to remove a portion of the pancreas, typically the head of the pancreas, where the majority of pancreatic cancers originate from. And in it, it involves removing part of the pancreas, the head of the pancreas, part of the small intestines, the gallbladder if it hasn't been removed already, and part of the bile duct, and then performing the reconstruction. It can take anywhere from 5 hours to 7 hours, depending on the complexity and prior surgery or prior treatment involved in the area. So it is a technically challenging operation with a whole set of complications that are unique to the operation, in which I think the Med Center is fortunate enough, since we have such experience with it, we are adept in dealing with the possible complications and then getting patients through it. In the past, the outcomes for this operation were not very good. So 30, 40 years ago, about 20% of the people died after this operation. Now it's significantly less, but still in general speaking, it's still about 8 to 9% in the country. Fortunately, since we do so many at the Med Center, ours is significantly less than that, even less than the 3% range. So we are fortunate, and the reason why that even though the mortality rate from the operation has decreased, the complication rate has not. What has happened though is that we've gotten very good at dealing with the complications, treating them, patients recover, and then get better. So we've gotten very good at dealing with the complications that in the past would have led to serious outcomes such as death possibly. We're now very good at treating them to prevent that and getting patients through the operation. So there's been multiple studies showing that it's advantageous for patients to seek centers that have done a lot of these, because not only is the mortality and the complication rate loss, but then the other things of getting patients through complication better, and there's a whole team approach in managing such patients. We're fortunate that the Med Center has such a reputation and has such a volume that does a fair number of these operations. So it's not just the surgeons, it's radiologists, it's the interventional radiologists, it's having competent, having good cardiology, good supports in other areas to help to all work together to get patients through when they have complications. So I think though that since this is a major operation, we do recommend patients seek second opinions. And oftentimes we are the second or third opinion, but as long as patients go and seek a qualified opinion about the operation, I think that they'll be in their best interest. So typically, for the national average is about 14 days. We have found though that if patients go smoothly and things heal well, they could be home in about 7 to 8 days. But still, it's fair enough to say that you should expect about 10 to 14 days would not be an uncommon stay, but it can be longer. It could be weeks, or even a month or longer, depending on the severity of the complications that do ensue. And it takes patients about 2 to 3 months for them to typically recover from the operation before they can say they feel good again. So we have done quality of life studies on patients who've undergone the Whipple operation, and their quality of life scores are typically very, very good once they've recovered. However, though, of course, we're still dealing with pancreatic cancer typically, for which there's number one reason we do the operation for. So there's still ongoing chemotherapy and or radiation therapy that may be ensued. And then, of course, quality of life may not be as great if the cancer does return. But in general, though, for patients who the cancer does not return, long-term studies have shown that patients who undergo the Whipple operation have a good quality of life. They do have to watch their diet, and there are certain other modifications that are entailed for their diet, but in general, though, a fair number of patients, the overwhelming majority of patients, have a good quality of life.